For anyone who is dieted and exercised, they go hand in hand, and they're evil words. Do your very best to separate them out. Exercise counteracts depression in virtually every single realm. It influences all of those hormones that we were talking about. It was funny, I was talking to someone just this morning about exercise, and they said, oh yeah, those endorphins. It's a myth. It was the very first theory of the runner's high was that endorphins was why, and that was about 50 years ago, and it stuck. They don't cross the blood-brain barrier. So although we are producing them in our body, they never reach our brain. So it's not an endorphin release that is causing that good feeling. It is actually a shift in the serotonin, the dopamine, and the epinephrine, all those hormones that we're trying to balance out. So you take any mental health condition and you get someone moving their body, it will shift those and raise those neurotransmitters. You need to move your body. It's super, super important. If you do nothing else when you leave, you need to incorporate a regular, consistent exercise routine. Very well researched, exceptionally well researched. It started back in the 60s. It was probably a little bit earlier than that, but the first one that I've got here is the Berkeley research. And there was another Dutch one, and then another Finnish one, and there's a ton of them. And basically they all came to the same conclusion, is that those who move have better mental health. You don't have to be running marathons or doing triathlons to get this effect. You can get this from day-to-day wonderful things like simple walking. It's really that easy. Although we will give you the formula.
Yeah, this next study, in 1999, so they compared exercise versus Zoloft, so a well-known antidepressant medication, for 16 weeks. The people either walked or jogged, as well as a warm-up and a cool-down, and they found that exercise was as effective as the medication over that time period. The medication works faster
Than the exercise program. Yeah.
But the exercise works better longer term. And we all know about all the other magical health benefits that exercise does. So
this was really a landmark study because they really finally decided to go exercise versus SSRIs, what's going to happen. And the results were phenomenal. And when they did the follow-up in 5 years, that's when they realized the people who were taking the medication had way more relapses than the people who had stuck with an exercise program. It was quite fascinating. And that's what really, really drove home. It was the springboard for a lot more. This book, Spark, I have it over here. It goes through all the different brain chemistry. It is way more complex than we could ever get into in a seminar like this. There are lots and lots of different neurotransmitters, different proteins that are produced by exercising that have an impact on your mental health. It's huge, very, very huge. And it's changing all the time. The other thing that most people don't realize is that there's actual changes in your brain that happen with depression, and that parts of your brain actually shrink. And they almost hibernate. Now they can be revived, which is good news. And another old debunked theory is that we can't produce more neurons, and we can. And we're producing more neurons and more pathways in our brain every few minutes. It's phenomenal what we can do. And you can actually change the pathways. If you have children who have difficulty learning, this book, absolutely you need to pick it up. It's phenomenal. Yeah. Exercise. Here's the magic.
Yeah. So here's the math. Yeah. So here's what you want to figure out is 220 minus your age. So 220 minus how old you are is your max heart rate. That's 100%. We're not getting at 100%. We want somewhere between 70 to 85% of your max heart rate. So you're moving. You should be able to talk to someone. You're not totally out of breath, but you're also not just sitting there on the ground. So Carrie did an example for her. Oh, I gave away your age.
On Friday.
So 220 minus 36, so 184. So we're counting beats per minute. What you can do is keep a stopwatch or your phone or whatever.
Or buy a heart rate monitor.
Heart rate monitor. Yeah, that's an easier way. Yeah. If you don't have one, you take your pulse, count it for 15 seconds, times it by 4. That'll give you your per minute beats, and that's what you want to be around within that range. And if you're doing that 3-4 times a week, you're golden.
Yeah, I usually recommend that patients aim for every day of the week because then you're probably actually going to do it 4 or 5. But if you plan on doing it 4 or 5, it might only happen once or twice, and then you can easily fall off that wagon. The reason why we picked these ranges is because that's what the SMILE study did. And the part that's cool about this is that that means that Whitney's target heart rate and her pace is different than mine. And mine might be different today because I'm feeling a little sluggish. So today maybe walking is what's really good for my body, and maybe tomorrow running is the best thing. So watching your heart rate with every workout really helps you tailor so that you're not overtraining, you're not going to hurt yourself, but you're not also just cruising along like thinking you're doing it. Biking is the worst for that because you're just cruising sometimes. Heart rate's doing nothing. So you think, I was out for an hour, I'm great. Not so much.
It was all downhill.
Yeah.